and go live on Facebook so we can share some good news with the folks. Okay, there we go. Lovely smile, yes, yes. Right, that's our title. Maximize your wellness, your self-care and resilience. Yes. And it's Rasheda Hatchett, right? Pronouncing that correctly? Rasheda, am I pronouncing your name correctly? Rasheda Hatchett?
Yes, you are.
Okay. All right, so here we go. We're getting ready to give. There we go. Okay, now we'll go live. All right, we are live. Good evening, good evening, good evening, everyone. It's your girl, Chere M. Goode, Dr. Chere M. Goode. I have to get used to using that now. So, Dr.
Yes.
Chere M. Goode. And this evening, we're just going to bring a moment of health and wellness to everyone. So, there's a lot going on in the world right now. So, what better person to get with than a nurse? And then talk to another nurse who has years and years of experience. And tonight, we're just going to chat it up, talking about how to maximize your health through self-care and resilience. And of course, now with everything going on in the world, we definitely have to be resilient. We have to have that bounce back after everything that's going on, no matter what's affecting us, whether it be COVID-19 or whether the current affairs that's going on with the senseless killing by the police this recently this week. So it affects us in so many different ways. As if COVID-19 wasn't enough, it seems like this current killing was just something else to add on to everything and the weight that everybody is going through. So tonight I have the pleasure of talking with my good friend Rasheda Hatchett. She's also a nurse, but I'm going to let her tell you a little bit about herself. But first, for anyone who doesn't know who I am Dr. Chere M. Goode. I've been dubbed the recharge strategist and self-care master. I teach busy professional women between the ages of 30 and 55 how to not only put themselves on their, not to only put their appointments on their calendar, but also to put themselves on their calendar and then center their other things around their self-care, because self-care is going to take you a long way. I'm the founder, CEO of Total Harmony Enterprises, Make Me Over Wellness, and Exceptional Wellness Company. I'm a 5-time #1 best-selling international author, speaker, and wellness coach. I've been a nurse for the past 30 years, and I currently am specializing in hospice care, so end of life care, making sure that people are comfortable. And so it's a wide spectrum from trying to get you to take care of yourself and be healthy, but also making sure that if you do have a terminal illness, that I make you comfortable towards the end of your life. So at this time, I'm going to give Rasheda a chance to tell us a little bit about herself, and then we're going to jump right in our conversation about how to maximize your wellness through self-care and resilience. So Rasheda, tell us about your fabulous self.
Oh, thank you so much for having me. I'm so excited to be here with you guys this evening. So, like you said, I am a registered nurse. I am a resilience coach and strategist. I work with highly motivated leaders who are looking to increase their personal resilience as well as create resilient teams and organizations. So, that is my focus. I'm the CEO of Rasheda Hatchett Media, as well as I am an author of Living Large, A Nurse's Journey Toward Resilience. So, we have that in common. And I also, in my nursing world, I work in long-term care facilities, working with clients who many of them are on hospice, but they are elderly and living in adult family homes. And I go in and do education for their caregivers around how to take care of them to keep them out of the hospital. So that's kind of my nursing side. And I have a master's degree in nurse education. So I love to teach. And that's part of where Rasheda Hatchett Media was born out of, and why I started that resilience coaching and strategy consulting business. So I'm excited to be here. Thank you guys so much for having me.
Yes, it is going to be an amazing conversation. So let's jump right in. So, to maximize your health, there are certain things that you have to do. And I'll let you chime on. I've created a list of 5 ways that we can maximize our health. Um, and we can just touch on each area and we'll go back and forth and just have a conversation like two girlfriends just chatting it up. That's the best way to me. Just have that organic conversation. It's not scripted, everyone. It's just literally the two of us. We decided we were going to do this, no questionnaire, nothing. I said, let's just give it to them real, raw, talk what we know, and just help some folks today. So, the 5 ways, I'm going to start but just by saying that everything else that we do in life, we always tend to want to maximize on it, right? Whether it's our finances, whether it's our relationships, whether it's our careers, we're doing everything that we can do in order to make sure that it is the best, right? So why don't we have that same sense of urgency when it comes to our health, when it comes to our wellness, mentally, physically, emotionally? Why aren't we making sure that we are maximizing on the most important part of us, which is our health? Because without us, none of those other things exist anyway.
Absolutely.
So I created 5 ways. We're gonna just have a little conversation about that. And we'll get to the resilience part because I know that's your area of expertise. So the first one is to know your family history. So in
Mm.
order to maximize on your health, you have to know your family history. If you don't know illnesses that may be running in your family, like hypertension, the cancers, things like that, diabetes. If you don't know your family history, how can you fix something that you don't know? How can you break that generational curse if if you aren't even aware of what it is?
Yeah.
What would you think about that?
Well, for me, I think that the biggest thing in knowing your history is the prevention piece. We have been so stuck in medical when it comes to wellness in treatment. We're consistently treating things. Treat this, give a pill, give a topical, eye drop, ear drop, all of these things. But where we're not focusing dollars and where we're not focusing attention is on prevention, right?
Mhm.
We have those clients who it's been diabetes times 5 generations. They
Right.
can't remember a grandmother or mother who didn't have it. And part of that is that there's been a lack of education on how we prevent that generationally, like going down the line. What do
Mhm.
we do around foods and what do we do around that prevention piece? That education has just been lacking.
Yes.
And now we're playing catch up. We find that there's a lot more talk about prevention right now. I'm not seeing the dollars there, but I'm seeing the conversations, which is where they
Yes.
start. And we've got a lot more internal conversations about wellness. And,
Yes.
the weight part of our wellness always kind of tends to be the taboo part. Like, listen, I already know I got a couple pounds I need to get rid of. I don't want to talk about that. Right. But that's such a big piece of knowing the history of your family and knowing these are the things that happen and then understanding what those
Mhm.
causes are so that we can prevent those things. And that for me is huge. Prevention
Yes.
is paramount, but that's part of what self care and wellness
Mhm.
is about. It is about prevention. You're really trying to prevent these things from either worsening or coming upon you altogether.
Absolutely, absolutely. I know, I always share the experience of my dad. He died in 2009, at the young age of 59 years old from a heart attack in his sleep. What does that do for me now? That directly predisposes myself and my siblings to heart disease. So now I know that I have to do things differently. I now know that I need to manage my stress. I have to watch my blood pressure. That entails watching what I'm now eating because I want to
Right.
break that family history. I want to break that mold that our family has set, that okay, heart attacks, cancer run in the family. So I don't
Right.
want to be a statistic. So now I have, if I had I not known his history and known what he died of, how can I fix
Mhm.
myself in order to not have that same thing happen to me at such a young age?
Right.
So number one, again, for those who are just tuning in, we're talking about knowing your family history. We're talking about 5 ways to maximize your health, and we're doing that through self-care and resilience. So we're going to talk about some self-care and resilience in a little bit, but right now we're just listing those 5 ways that you can actually maximize on and just having a discussion about it. So the first one, again, was knowing your family history. If you don't know, ask some questions, talk to some aunties, talk to your uncles, talk to your grandmother if she's still alive, your parents. Ask them what was the biggest thing that went on in the family. What was the biggest illness that took our generation away? And when they tell you that, now you need to know that it directly affects you, whether it's years down the line or not. Generational health and generational illnesses do go for years and years to come unless we do something about it. Number
Absolutely.
two, listen to your body. How
Mm.
important would you say it is to listen to your body? I talk about this all the time,
Ah,
and listening to your body to me is like over almost everything other than knowing your
yes,
generation, your family history. But
yes.
listening to your body is imperative. Let's talk about that.
Listening to your body is 101, right? Like that's like
Yes.
the one of the most simplest things you can do, but one of the most complex as well, right? Because we know when it comes to listening to our own bodies, we tend to tune our bodies out.
Yes.
We're tired. My eyes are tired. I'm done with this computer, right? My back is aching, right? My feet hurt, and we tend to just continue to push through. And
Yes.
especially when we're talking to nurses, right? It's a occupational hazard for us. It is also something that we carry into our personal lives as well, because we're just so used to suppressing how we're actually feeling and what our body is telling us. I
Absolutely.
just did a post about this last week, which was listen to your body when your eyes are tired and your back hurts and you got that headache,
Mhm.
that you know what it's from, right? You know this is your stress headache. You've got to listen to your
Yes.
body. You have to go, okay, it's time for me to cut the computer off. It's time for me to turn the lights
Mhm.
out. I need to put this away. And that is one of the most difficult things for us to do, because there's so much to do in this busy world we have. We have all of this busy work that we're busy planning and busy doing, that we often forget that we're needing to listen to our bodies. We're needing to say, okay, I'm tired, right? I need to have a rest. My feet hurt.
Absolutely.
That means I need to put them up, and I need to be wearing compression stockings. Okay. Right. So those are the things that,
Yeah.
I don't want to wear no granny compression stockings. However,
I want them
right,
varicose veins.
right. So it's those things, it's that listening, but
Yeah.
again, that ties so much into knowing the history, the prevention piece. Listening to your body is paramount to prevention. Paramount.
Yeah.
Your body's going to tell you first what's happening. You know when things are not right. And so it's just time. It's high time for us to listen and just go,
Yeah.
okay, I'm going to rest. I'm going to put my
Mhm.
feet up, right? I'm
Yeah.
going to wear that back brace that I hate, but my back is not sore at the end of the day when I wear
Right.
it. I'm going to wear
Yeah.
it.
And we should know our bodies better than anybody. It shouldn't take a doctor, like you said. We know our bodies. We should know ourselves. If we don't, it's time to really like tune into ourselves. But
Right.
it should not take a doctor to tell you that something is wrong.
No,
You should be knowing something is wrong way before you ever see the doctor. And if
absolutely.
you should know your body in a lineup. If somebody showed you a picture of your body without your head on it, you should know what your body looks like,
Mm-hmm.
without your head being on there,
Yes,
basically. And I
yes.
like to say, like, when our bodies talk to us, it's almost like traffic signals.
Yes.
So, what do you got? The green light, the yellow light, the red light. So when you're doing
Mhm.
everything you need to do, you're eating healthy, you're exercising, you're getting proper rest, you're in that green, you're getting that green, you're getting that go full speed ahead signal, right? But then as you start to um cut out, eating healthy, you start drinking more sodas, you're eating the junk food, you're eating the crap.
Mhm.
When you start to do that, now your body, you're not sleeping enough. Now your body's saying, I don't know if I
Mhm.
want to act right because she's not acting
Mhm.
right or he's not acting right. So then you start to slow down. Your immune system starts slowly getting affected. You might get just a simple cold, maybe something mild, but you feel a little run
Yeah.
down. You're just not quite feeling yourself. that's when it's time to take some action, because your body, that's that slow down phase. But then finally, if you just ignore that sign that your body is telling you something's just not quite right, and you don't
Mm-hmm.
slow down while you're in that slow down, when you get in that yellow light, your body will go into the red zone.
Oh yeah,
And what is
it's
that
gonna
red
lay you
zone?
out.
It's
Mm-hmm.
going to lay you out. You're going
It's
to
gonna
come
lay
to
you
a
out.
complete halt, whether you want to or
Absolutely.
not. You're going to stop.
Absolutely.
Whether you want to or not, you will stop. So it
You
is
will.
imperative that we listen to our bodies. Any little sign, you shouldn't be ignoring it. If you're having a headache for more than one day, that's a problem. You need to be
Yeah.
going to the doctor.
Yep.
There's a reason why your head is aching. It could be stress. It could be your blood pressure. It could be a number of things. Take the guesswork out of it and go ahead and go to the doctor. If you're having a headache more than
Absolutely.
2 days, especially, you want to go to the doctors. One day you take something, it goes away, fine. But second day, that third day, and you've been taking medication and it's still there, it's time to seek medical assistance.
Absolutely.
Thanks everybody that's tuning in, even on our social media. We have a nice platform there.
Yeah.
And thanks for everybody who's here on the live link. Right now we're talking about 5 ways to maximize your health. We maximize on everything else, our careers, our finances, our relationships, but we don't take care of the most important thing, and that is our health. So number 1 was know your family history. Number 2 is listen to your body. Number 3 is work your body. Work your body. What does that mean? That means we're going to get moving. If
Yes.
you lose what you don't use. That's what I had a nursing instructor who used to always tell me, that you use what you don't you lose what you don't use. So if you're not using your body, if you're not moving your body, if you're not exercising and just staying active, tell them what's going to happen, Rasheda.
Oh, you're going to lose muscle tone. When you
Yes.
begin to lose muscle tone, you are not going to be able to have the kind of stamina when you do get ready to get up to go do that yard work, and you're like, I used to be able to do this, right? And now I can't. You're going to put your body at risk of so many diseases and things that come upon you because you're not moving, right? Stasis, that's what, look, we using these medical words. Okay, let me quit. Okay, so being stagnant, not moving, right? And that stillness that you can have is really going to put your body in a position where it just doesn't get what it needs to recharge the way that it should.
Right.
So you are going to consistently be working at this deficit where your body is just not doing any of what it needs to do because it's just so used to not moving. And so you got to get up, you got to get moving, you got to get blood flowing. There's a commercial that says, it's for some medical some medicine or something says a body in motion tends to stay in motion. And I use that phrase all the time because it's so real. If you continue to move, you continue to exercise your body, exercise your brain, all of those things you continue to do, then your body gets used to that. And when it gets used to that, it will continue to crave that. So those of you that are, hanging out on the couch, your body starts to just crave just sitting around doing nothing,
Right.
but when you get up and you start getting moving, your body gets used to that 6 p.m. after dinner walk. And it's like, hey, where we going? I'm ready. Where we going? So you just want to make sure that you keep that. You got to keep that motion. You got to keep your body moving. You got to keep your brain moving. You got to make sure that you're really feeding yourself everything that your body needs in order to continue to go and to give you what you need. Because if you don't feed your body will not feed you. You will consistently be tired and feeling like you just don't have anything left in the tank.
Absolutely. And then we're talking about maximizing your health. So why not maximize your health and feel good? So when you're moving, you're releasing those feel-good hormones, those endorphins. That's going to make you have that extra pep in your step. You're going to feel vibrant. You're going to feel recharged. You're going to feel rejuvenated. And that's what it's all about. If you feel that, if you feel rejuvenated and recharged, it's going to give you the energy to do even more. So avoid your muscles atrophying, which means wasting away. Get to moving your body. It could be simple movement. I know my girlfriend Delana Watkins, she's been starting to do her hula hooping. And so with her hula hooping, she's been showing folks with the weighted hula hoops. You can walk, you can bicycle, you can do so many different exercises. The opportunities and the variations for exercising are really, really so broad that there's no excuse. We can take all the excuses out of exercise.
No. And do something fun. A lot of us
Absolutely.
get caught in having to go to the gym, but then we're like, but that's not fun. It feels like work. Well, why? When we were kids, we jumped ropes, we played tetherball, we double dutch. Do that. There's nothing to say that, in your 30s, 40s, and 50s, you can't jump a rope. Like, if that's what's fun, do that. Do a dance.
The recovery time might be different, but you can still do it.
Listen, yes. It will be different. It is not
Got
going to feel the same. I double dutched a couple years ago, and I was like, girl, I used to be on the team, and now I need to go and stay in the stands and be cheering because these knees, they can't do what they used to because I double dutched on concrete. That's what we had when
yeah,
we were
yeah,
kids. We had no idea that we were tearing our knees all the way up with that. But do stuff that's fun.
yeah,
Find
yeah,
something fun you like. If it's dancing, dance.
yeah,
Dance.
absolutely.
J-Lo had said one time that she doesn't work out. She doesn't really do the gym. She dances for like
Yeah,
7 hours a day
yeah,
because she just loves to dance. So she just dances. Now, you don't have to do 7 hours because that might not be your ministry. However, if you love to dance, just dance. Turn on some music,
absolutely.
dance, pump a sweat, and you've got your workout.
Yeah,
And you did something that was fun. And if it's fun and you enjoy it, you'll do it again. If you don't like it,
absolutely.
you never doing it again. You can be like, no, not that.
Also, another thing is if you have pets, pets tend to make you exercise because you have to walk them. They want to run around. They want to play. I know my
Yeah.
son is home right now from college due to COVID-19, and he has this puppy, and he just wants to play, 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 play. And so I find myself running through the house with the dog, and it's like,
Yeah.
okay, so you're moving some extra muscles here. We like this. We like this. It
Mm-hmm.
feels good playing with him and things like that. So pets can be a benefit to your health as well. All right, we're gonna
Absolutely.
keep it moving. So we're talking about 5 ways to maximize your health. Know your family history, listen to your body, work your body. Number 4, feed your body. So what are
Yeah.
you ingesting? We all heard that statement, you are what you eat. Well, it's true. You are what you eat. If you eat
Absolutely.
crap, that chemically refined, altered, processed foods, that fast food, that junk, you're going to feel like crap. You're going to feel like
Absolutely.
junk, and your body's going to look like junk, and it's going to look like crap. I know we've all seen that picture. They have a picture floating with a lady just like, oh, you see his rolls everywhere, and they have like the food, and the food make up the arms, and the burgers and the fries make up the body. That's true. If you
Yeah.
ingest crap, you're going to feel like crap. But if you do,
Absolutely.
instead of crap, replace it with crow, which is that clean, raw, organic, whole foods, that's going to leave you feeling just that, energized, whole, rejuvenated, recharged, feeling great. And it's going to look really, really great on the waistline.
Absolutely. Absolutely. What you eat is a huge part of how you feel and how you're feeding your body. Are you getting enough vitamins and nutrients? We know you're not going to get them from a burger and fries. That's not going to happen, right? So are you getting enough? And if you're not getting enough, you are going to feel tired and sluggish. It
Yes.
just is the way the body is made up. Our body is truly made up to absorb nutrients and then use them in order to fuel us throughout the day. And so we've got to be ingesting them. You've got to eat them. You've got to take a vitamin supplement if that's what you need. You need to do
Mm-hmm.
that, but you need to eat them. It's not just enough to take a vitamin and then eat like crap. That's counterproductive, right? We have to eat well and take a vitamin
Mm-hmm.
to help us. And especially as we start getting older as ladies, we need a bit more vitamins. We want to prevent osteoporosis, and we want to make sure that we're ingesting enough so that our body is not stealing vitamins from our bones, because that's the thing, y'all. That's how you get osteoporosis. Your body is stealing that calcium from out of
Mm-hmm.
your bones. So we need to be ingesting enough of it to feed all the rest of the parts of our body so that it's not getting stolen and we're not feeling like, well, if I break this hip now, it's going to be a whole problem, right? We want to make
Yeah.
sure that we're taking in what we need.
Mm.
And that's easier now than what it was even 5 years ago,
Yes. Yes.
because the information is out there and there's so much to know and to learn
Mm.
about what vitamins work well for what things, what foods we're going to be ingesting that are going to give us what vitamins we need.
Right.
And then a lot of us, our doctors, are able to do vitamin panels, which wasn't even a thing
Right.
15
Right.
years ago. They didn't even care to do it, and now you can do it. Find out where your deficiencies are and then
Mm-hmm.
ingest that more, take it in more, whether it's in a liquid vitamin, whether you need a gummy vitamin, and you're going to use your food source to get some of it as well. So you've got to feed your body good stuff. You've got to feed your body what it needs. And there's no better way to find that out than to actually do a panel and see, what are you missing?
Yeah.
What are you not getting from your diet so that you can add that in?
Yeah, and a lot of times the doctors don't just jump up and do it. So
No.
be an advocate. That's one of my 8 recharge pillars of self care is self advocacy. So you have to speak up for yourself. Ask for it. Like, listen, I feel like something is depleted. I want to know, am I getting enough vitamins, and then you were talking about that your body stealing calcium. Yeah, that's when you start getting that tooth loss because the body's going to
Mhm.
take what it needs. So
It
making
will.
sure that we're eating enough of everything we need. Good point. And then let's talk about hydration. A lot of times people are walking around dehydrated. So
Yes.
you don't, they're like, I can't drink a gallon of water. I can't, the recommended amount of water is half your body weight in
Yeah.
fluid ounces of water. So if you're 100 pounds, you need to be drinking 50 fluid ounces of water every day. And that doesn't mean that you actually have to physically take bottles of water and guzzle them, guzzle them, guzzle them. There's water in your food. So eat foods that are high in water content,
Yes.
like your fruits and your vegetables, like your apples,
Yes.
your celery, your cucumbers. Those foods are high in water content, so you can kind of carve those off a little bit as some of your water intake
Mhm.
as well. The whole goal is just to keep drinking, stay hydrated. You're going to keep your body free of infection and viruses, because you're going to be flushing out anything that tries even to attach itself to you. You're going to stay
Mhm.
hydrated. Your skin is going to thank you.
Yes.
Skin is going to
Yes.
love you. It's going to give you this glow. If you are somebody who suffers from headaches, 9 times out of 10, it's because you may need to
To
be
dehydrate.
increasing your fluid intake.
Mhm.
Yeah. So those are
Mhm.
some of the things. Feed your body, take care of your body. It will take care of you. Now, number
Absolutely.
5, because we're going to keep on going so we can get to that resilience piece, because I can't wait to hear what you have to say. Rest your body. So we're
Yeah.
talking about 5 ways to maximize your health. Know your family history was number 1. Number 2, listen to your body. Number 3, work your body. Number 4, feed your body. And number 5 is rest your body. So sleep is imperative. So it's
Right.
recommended that we at least get 8 to 9 hours of sleep every single night. A lot of people say, I don't sleep more than 4. Okay, everybody's needs are different. But if
Mhm.
you're only getting 4 hours of sleep, is your body truly getting the restoration period that it needs? Because we're like a
Mm-mm.
fine-tuned machine. Think about your computer. If we never ever turned that computer off, it wouldn't get the updates, right?
Never.
And it would overheat if you just let it run, 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 or that fan would be blowing until you kill the fan out.
Yeah.
If you just let it run, 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 and never turn it off, it would overheat. Well, the same thing with our fine-tuned machine, our bodies. If we never
Mhm.
ever have rest periods, if we never ever take breaks, if we never shut it down, we
Yes.
will burn out. And that's that red zone we were talking about, that whether you like it or not, your body will shut down if it
It
needs to.
will.
So,
Absolutely.
yeah, go ahead. I'll let
Yeah.
you mention.
I am big on sleeping during the
Yes.
nighttime when you're supposed to
Yes.
be sleeping. So, I'm sure we've got folks who are not nurses. And so, when you're not medical, this might be something you don't know, but your body releases a hormone at nighttime between the hours of, I believe it's like 10 p.m. and 5 a.m. And it's
Hmm.
human growth hormone. And this is what your body uses to restore your cells every night. So we do all kinds of damage to our body every day. And it's not just stuff that we are doing. It's our environment.
Yes.
It's the smog, it's everything that's going on. And so at nighttime, when we're asleep, when we get into that deep sleep, our body releases human growth hormone and we regenerate. Our cells literally heal themselves
Hmm.
overnight. That's what happens.
Yeah.
If you're not sleeping during that time, your body doesn't release human growth hormone. You don't
Hmm.
regenerate. So
Hmm.
when you string together multiple days, weeks, months of not
Yes.
sleeping well during that pivotal time, you just feel like crap. And there's
Yes.
not a soul on this planet that will convince me otherwise, because I've done it. I've done it. I've strung together a bunch of days where I just did not sleep well and I felt terrible. I felt like I really didn't know what was happening. People are talking to me and I'm answering, but I'm fumbling over my words. I'm just kind of like,
Hmm.
I don't really know the answer to
Hmm.
this, right? And these are things that I
Hmm.
know. And so often we tend to burn that midnight oil, especially for those of us who are entrepreneurs and we're the everything for our business, right? We are the everything. We're
Hmm.
answering all the emails, we do collection calls, we are everything. What happens is that we're up working way too late. And
Yes.
because of that, we tend to be in situations where we just don't feel our best. We are not optimal. We're not. I can look at pictures of myself when I was in the midst of doing all this stuff for work and I'm go, go, go. And these pictures look super cute, but I can tell in my eyes, I'm like, oh, clearly I was not sleeping well there. I
Right.
can see it on my face. So, that goes back to listening to your body. right?
Hmm.
Listening to your body. You have to listen. You have to know that you really are tired. When people tell me, oh, I'm not tired, that's not accurate, dear. If you cut off that TV, you turn that phone off, you turn that laptop off, I guarantee you're going to fall asleep. And
Yeah.
if you won't, then we need to go to the doctor because you got a problem with insomnia that we need to figure
Hmm.
out.
Absolutely.
Right?
So I love that because when we think about sleep, we just think, oh, okay, I just got to get some rest. It's not
Mhm.
just about being physically rejuvenated, but also mentally. I love that part you said, yeah, you're just not right. Like you can function sometimes. You can get through
Mhm.
the day, but you're sluggish, you're dragging, your focus is not there. You
Right.
find a hard time, like you said, finishing your thoughts.
Yeah.
That communication piece is just not there. You may have to close your eyes and like, oh, what did you say again? Like you're not hearing.
Mhm.
So sleep is imperative. And I always in my trainings teach about preparing for sleep. So we prepare our meals, we prepare for appointments and meetings. Why don't we take the time to prepare for sleep? When you go
Mhm.
into your resting place, what does your brain already know is happening? Is your brain going to get the signal to say, oh, it's turn up time. She about to get it in. She's about to start working on that computer. She's about to turn the TV on. She's about to text some people. She's about to get on the emails. What is your brain conditioned to do when you go into your place of rest? So,
Right.
in addition to the HCG hormone that you were talking about, melatonin is released in our sleep as well. And
Absolutely.
and if we have like that ambient light from the cell phone, or we have light from the cable box or the TV, it interferes with that melatonin absorption, which again is going to interfere with our sleep. Any light interferes
Absolutely.
with your melatonin absorption. So a couple things we can do in order to enhance our sleep experiences. Number one, it's been noted that sleeping in the nude actually is better for you than sleeping with
I
clothes on.
didn't know.
Yeah,
Okay.
because of
I
the
didn't know
hormones
that.
that are released, sometimes we don't allow all the hormones to be released because the clothes are trapping them onto our body. So we need to be free, people, be free.
Yes.
Hormones be released. Also, make sure you're in a dark environment. So even if you have like that outside light that comes and pierces into your window, either get the blackout curtains or blinds so that that can, help with your melatonin absorption and not hinder it. Making sure you sleep in a cool environment so that you're not restless and sweaty and things like that. So I know I sleep with two fans, but it's a generational thing. Our daddy did it to us. But sleep with a fan, and putting a fan on is like having oxygen. It's non-pharmacological oxygen. And a lot of people don't know that. So it enhances your breathing, which is going to help you to sleep better. Also having that right pillow, because I know if I'm sleeping wrong, I wake up with that crook. You're tossing and
Mhm.
turning because you just can't get comfortable. And so doing things like that will help you to enhance your sleep experience, help you to sleep better, cut everything off. It's time to unplug. So
Yes.
if you find that you get in bed and then you're not having the easy time falling asleep, get out of the bed.
Yes.
Get out of the bed. And there are also some things you can eat that actually will enhance your sleep experience, like peanut butter, like boiled eggs. Make sure you're doing this like an hour before you're going to bed, though, so that your body's not trying to process and not trying to metabolize the food in sleep, because then you'll wake up. But do it about an hour or more before you go to bed, because boiled eggs have melatonites in it, which is the same
Okay.
component of melatonin. So it's going to make you sleepy. It's going to make you want to go to sleep. And then the peanut butter, because it's protein, of course. It's just like when you have the turkey sandwich or something, you get sleepy after. I think it's tryptophan that is released when you eat turkey, and that's why we get the itis and we get sleepy.
The
And so you
itis
can
is
do
real.
things like that. Yes, it is. So things like that. And also, I heard recently on TV that tart cherry juice is another remedy, that if you drink tart
Okay.
cherry juice before you go to bed, maybe like an hour before, that it helps to enhance your sleep experience. So those are some things we can try. I know a lot of people have tried the peanut butter, because I told them about that, and they said that it did work. It helped a lot. And these were people that were up all night, like couldn't sleep at all, like maybe 1 hour. So they said the peanut
Uh-huh.
butter did help. So I'm like, okay, good. I'm glad. So bananas is another thing because of the potassium that helps with sleeping as well. So just enhance your sleep experience. It's going to have you being more focused, recharged. You're going to feel vibrant the next day. So that
Yeah.
those are the 5 ways to maximize your health. Again, I'm going to repeat them for anyone who just came on. Know your family history. We're breaking those generational curses and that generational health events and things that's going on. Number 2, listen to your body. If your body tells you something's wrong, then it is. Don't ignore it. Don't wait to go to the doctors. If you feel like something's not right, go.
Oh,
What's the worst that can happen? They say, oh, you're okay. Maybe it was just a bug or something, but go get it checked out. Number three, work your body. Get that exercise in. Release those feel-good hormones. Move your body. I don't care if you're dancing, like Rashida said, or you're
Yes.
cleaning up the house with some music on and just, have some fun with it. Ride a bike, skate, play with a pet, run around with your pets, do things like that. Just keep your body moving so that you can feel rejuvenated, release those feel-good hormones. Number four, feed your body nutritious foods. Avoid the crap, those chemically refined, altered, processed foods that are not going to stay with you long and they're going to leave you feeling just like that crap. And then
Yes.
adopt the crow, which is that clean, raw, organic, and whole foods that's going to leave you feeling rejuvenated, recharged, and whole. Last but not least, rest your body. Try your best to enhance your sleep experience and get at least 8 to 9 hours of sleep every day. What are the benefits? You're going to have better health, longer life, longevity. You're
Yeah.
going to be breaking those generational family health conditions. And number four, you're going to have sustained financial stability. Why? Because you're not going to be spending your money on medical expenses and medications. And so we're going to move on now to the next portion of our topic. So again, anybody who's just tuning in, everybody on Facebook, everybody on the live feed, thank you for being here. We're talking about maximizing your health through self-care and resilience. And so I know Rashida is really, really big on resilience, that bounce back. And right now, the state of the world is really uncertain,
Yeah.
confusing. So a lot of
Yeah.
people are anxious, depressed, they're confused, they're uncertain, they're feeling hopeless. And
Yeah.
all of those things can really, really disturb a person's inner peace, their joy, their
Hmm.
stamina, because it's exhausting.
Yeah.
Just watching the news alone, you get exhausted. So sometimes we have to unplug. But
Absolutely.
resilience and self-care can pull you through. So talk to us
Absolutely.
about being resilient and how that affects your health.
Well, I think one of the big things is that a resilient person consistently really sees optimism. They
Mhm.
really live through the lens of this is not the worst thing in the world, right? We will get through this. I will get through this. And when you can see the world that way, when you're not looking at things as though they're the worst thing that could happen, you're never going to get through it, and you just have this cynical outlook. When you're looking at the world that way, it causes that depressed mood. That is
Mhm.
real. What you tell yourself and the way you speak to yourself really does have an effect on how you live your life, and what you let in really has an effect on what you put out. And
Yes.
so if we're making sure that when we speak to ourselves, it's in a way that really respects that life will go on, and we will get through this, and this is not the worst thing that's in the world, this is not the end of the world, we can bounce forward, that's real. When you look at the world that way, what you see is something very different from what you saw before. What you saw before was doom, gloom, destruction, and the worst stuff. What you see when you have that lens of optimism is the joy, the love, the passion, the goals, the dreams that can come forth at the end of this. And that's the piece that we live for, right? None of us lives for doom and gloom. Like if we thought doom and gloom was all we had to say, please, I'm out. Like I don't have it. I
Right.
can't do anything with that.
It's exhausting.
It's exhausting. It's
Yeah. Yeah.
exhausting. But when you can see the flip side of that, when you can see how the dream is going to come together at the end of it, when you're still setting goals and you can really see how life is going to be, and that
Yes.
the rose color that's going to be on the other side, when you're really going, oh my goodness, it's going to be so great. Like
Yeah.
I can see it when you envision the success of the thing.
Mhm.
When you envision getting through it, then you get through it, because your mind is a powerful thing. Whatever you tell it,
Yes.
so that is. Whatever
Yes.
you speak to yourself, that is what is going to happen.
Mm.
So we have to practice speaking life, things that are life giving, things that are life receiving, right? On
Mhm.
both sides of that. So for me, that's the big, big, big piece, right? Is making sure that we're looking at the world through this optimistic lens that this will get better, life will get better, things will return to a state where we're comfortable with at some point,
Right.
right? It's not going to be this way always.
Right. Absolutely. And listen, we did not have a conversation or anything about what we were going to
Mhm.
discuss tonight. So it's crazy because I wrote down four different things on my sheet that I said, you know what I'm going to say about resilience. So to be resilient requires the four R's: refocus, recharge, regain clarity, and repeat positivity. So refocus. Don't stay stuck in that place of hurt, of depression, of sadness, of hopelessness. It's okay to say you're not okay. What's not okay is to stay stuck and stagnant and not do anything about not being okay. So I always have this saying when I talk about healing and forgiveness, which it still can tie into this. The healing part is it's up to us how long we let what hurt us haunt us.
Yes.
So the state of the world right now is hurting us. There are a
Absolutely.
lot of hurt people, and the world really, really needs to heal. But
Yes.
it's up to us how long we stay stuck in that hurt state. So we have
Absolutely.
to begin to heal. And sometimes the healing may take taking action, like we see people right now taking action. They feel like their way of healing is by marching and making their voices heard.
Mm-hmm.
But each of us know what we need personally in order to feel like we're healing from hurt.
Absolutely.
But we can't let what hurt us haunt us for the rest of our lives. The
No.
important piece of that is to take action so that you can bounce back and have that resilience that you were talking about.
Mm-hmm.
Recharging, that means, again, going back to the things that we said that's going to maximize your health, getting that proper rest, unplugging from everything, sometimes just having that moment of stillness. And when I say moments of stillness, I'm not meaning sitting on the sofa with the remote in your hand and doing this. No, it means like nothing, no music, no radio, just silence, you and your private thoughts. That's going to help you to gain
Absolutely.
clarity. That's going to help you to refocus. That's going to help you. It's a form of meditation as well. Taking deep breaths and just
Mm-hmm.
being in that moment to simply do nothing.
Yes.
And you will be so surprised how powerful just doing nothing is. And a lot of us
Mm-hmm.
don't know how to do that. So
Mm-mm.
today I was watching the funeral on the news, and they did that moment of silence for the 8 minutes and 50 some seconds. I think it was 8 minutes and 56 seconds or 59, 56
Mm-hmm.
seconds. You could see after like 1 minute, people were fidgeting. They couldn't keep still. They were moving. We are so conditioned to doing something and just
Yes.
constantly moving. And let me tell you that 8 minutes felt like forever.
Yeah.
Like I stood there in silence and I was just like, wow, 8 minutes is a very, very long time because we're not conditioned to just being still. So that's another thing. And then regaining clarity. We get that clarity from those moments of stillness and then repeating
Mhm.
positivity. I love what you said. That's why I think you saw my notes.
I
So,
did it. I did it. I promise I
repeating
did.
positive things, like, yeah, positive
Yes.
affirmations, getting up in the morning, even on your worst day, and getting in that mirror and looking at yourself and saying, I am resilient. I am wonderful. I am enough just as I am. I will make it through this day, even though I don't feel like it. It's okay to not be okay. What's not okay is not to do anything about it.
That's right.
Yeah.
And I also feel that, I always say, you're not okay, you're not okay. You just can't stay there,
Right.
right?
Right.
And that's the piece that people are like, really? Yeah, you can't stay there. You can't stay there. You have to come out of that because you're
Yeah.
responsible for your own happiness, right?
Mhm.
That's not on anybody else. That's not on a situation. That's not on
Yeah.
an outside source. That's not on things, right? You are
Yeah.
responsible for your own happiness and you are responsible for staying stuck. If you're
Yeah.
stuck, you need to get unstuck. And how you do that, that might be the piece that you're not exactly certain on. How do I do that? But that's when we start reaching out and we start talking to
Yes.
other people and asking questions, looking for mentors and coaches and,
Mhm.
people that are going to help, pull us out of that stuck place. But you
Mhm.
can't stay there.
Right.
Staying there is going to cause you to be unhappy, unfulfilled. You won't have any connectedness to who you
Yeah.
are and what you do, what you like, what anything, because you have stayed in the stuck space and allowed yourself to just revel in that. And it will cause you to continue to be there. And no one wants to be a negative, person who just can't get out of their own way. Nobody wants to be that
Mhm.
person. But that's what you turn into when you stay in these stuck places because in your mind, nothing is good. And you're right, because you haven't allowed anything good. So nothing's good. And so because of that, you've got to find a way to come out of that so that you don't end up being that person who, everything is the worst thing in the world. I call those
Mhm.
people Eeyores. Nobody wants to be an Eeyore. You're just depressed. Everything is bad. Nothing's good.
Right.
No, and who wants that? That is exhausting. That's
Mhm.
exhausting. So we've got to come out of that. We've got to be responsible for our own happiness, pulling ourselves out of some of those situations. And
Yes.
certainly, if you're in that situation and you can't get out, we need to talk with a medical professional because that may be more than stuckness. If you're
Yeah.
in full on depression, that's not something that, your coach is going to help you get out of. That is something
Right.
that you need to see a therapist for because you are really in a place of turmoil, right? And that's something different
Mhm.
than
Yeah.
being able to look at things differently. That is something that we need to, we always have to respect that as medical professionals. We're like, there's a point where this is beyond what you can do alone, and
Yes.
so we need to reach out and get help. And then there's a point where we need to reach out for the right help, and that may
Mhm.
not be a set of friends, that may not be
Right.
your general support system. You might need a doctor, and that's okay. Whatever
Yes.
you need,
Mhm.
and that's okay.
Yeah, because the goal is to be whole. So we're like a three-part puzzle. If you're putting a puzzle together and one piece is missing, if it's bent, if
Right.
a piece of the picture of it is torn off, when you go to put it together, you don't get the clear picture. You don't get the full picture, right? It's the same
No.
with us. If mentally, physically, emotionally, we are not together and whole, then people, the world, you don't get to see the
Mm-mm.
beautiful picture of who you truly are. You don't get that
Absolutely
whole
not.
picture. So
No.
it's important that we work on whatever piece or part of us that needs fixing. And only each of
Absolutely.
us individually knows that. So the important part is to do the work. You have to do the self
Yes.
work. Yeah, you have to
Do
do the
the
self work
work.
and make a decision that you're going to do it.
Yeah.
So I wanted to lighten the load up a little bit and just have a little fun with you. So I have a couple questions I'm going to ask you, and then you
Yeah.
can answer them honestly. What's that one song that gets you pumped up to go through your day?
I'm every woman. It's all in me. That's
Yes.
my song. I love that song. It really does get me totally pumped. I'm ready. I'm like, yes, I am every woman. Okay, I can do
Yes.
anything. I can do anything I put my mind to. Like, that song. I'm in there, and I'm like, yes. That's my like internal like mantra jam. Like that's the one.
Oh, yeah, I love it. I love it. Yes. All right. Second question is, what is your favorite ways to recharge after a long, busy day?
Oh my goodness. I absolutely love reading. So
Okay.
I will read a book. I read articles, even though sometimes people are like, you read articles? And I'm like, yeah, I like dig right into them. And, I'm reading, especially if they're concerning resilience or anything,
Right.
on that. I love that stuff. And so for me, reading is a big one, and I hated to read when I was younger. And I hated to read in nursing school. I hated those books.
Yes,
But
Lord. Oh.
when I got done and I started to read for pleasure, like full
Mhm.
pleasure, I was like, oh my gosh, I love reading. It really is an escape. So I read. I like reading books more than I like reading articles, but that's one of the things that I do is I read. I also really really love to just sit and write. I love to write, so I'll sit and I'll write. It's not always like journal type writing, but I write letters to people that they're never going to
Mhm.
get, and, things like that. So I like to write, so I'll sit and I'll write. I love to make lists. This is so bad, but I love to make lists. It kind of calms me to get everything that I know I need to do. The day has
Yes.
come to an end, and I have all this stuff that I still need to get done, and I like to just put it on a list. I just put it there, and then I release it though.
Yes.
That's the beautiful thing about writing it down is then I release it to that paper and I don't have to deal with it anymore because I know it's on the paper. And so then tomorrow, now I go through the paper and I'm like, okay, what was on that list? So those are
Yes.
things I love. I love to do. Talking to girlfriends, that's always a wonderful thing. I love spending time with my girlfriends, and just hanging out on somebody's back porch, having a
Right.
cocktail or wine or whatever we choose, and just decompressing. Um,
Mhm.
but however you do that, everybody does it differently. However you do that, please do that.
Yeah.
If it's your environment, some people love. I like to be outside in the evening time, but everything's got to be perfect for that. Grass got to be cut. It's got to be kind of
No
feeling kind of good,
bugs.
right? No bugs, right? You got to have your little citronella around, keep the bugs away from you. But that's also really, really, really fun.
It
Is to just
is.
hang out in nature a little bit and just look out at the world and just see. I don't know. It's always wonderful to be reminded of how small you are and how small the things you're dealing with are compared to how big and vast our world is. So that's one of
Yes.
the things I like to do as well.
Awesome, awesome. Well, my song that gets me pumped is Mary J. Blige. Fine, 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 fine,
I
fine.
love that song too.
Woo!
Yes,
That's one of my jams that gets me pumped. I used to always back in my clubbing days. I used to get me up. They used to get me up. I would go and shake a little leg, get on the floor.
yes.
So Mary J. Blige, fine. As far as recharging and unwinding and relaxing, I like moments of stillness. So I can
Mhm.
remember when my sister, she wasn't well, she was in the hospital. I stayed with her at the hospital. She just woke up out of her anesthesia. She's like, one eye open, like, I can't believe you've been sitting here all this time with no TV, no noise, nothing. I was like, I absolutely love silence. And I wasn't always like that, but I
Mhm.
appreciate silence and moments of just stillness and being at this point. And I love my wine. I love kicking my heels up and just relaxing and sometimes watching a good movie is a way that I recharge too. But I like outside, but no bugs. No, we're not doing the
Mm-mm.
bugs.
I don't like the bug.
Yeah, I'm not an avid reader, but I do write. I do a lot of sitting and thinking, and then I do make lists like you do. Like, okay,
Yeah,
these are at the top of the list for tomorrow, and whatever didn't happen today goes up to the top tomorrow as a priority. But the thing about my list every day is that I am at the top of it. So
that's so
self-care,
paramount.
that's the first thing. Me time is
Yes.
the first thing because without me, none of those other things are going to happen anyway.
Nope.
So that's what I think is so important for each of us to know that put yourself on your calendar first and then everything else should be coming afterwards.
Yes.
All right, last question for you. Can you give us one or two resources, self-help, self-care, resilience resources that you would recommend or that you've used, either one, to help our audience today?
So I think one of them is a mindful tool that I use to assess self burnout, right? And you can do it kind of anytime. And the reason that you need to know kind of, am I burnt out? Am I like over where I'm at? Is because that really directly affects your ability to be resilient. If you're already burnt out, you're not bouncing back. You can't, because you're in just this burnt space. You're not able to really
Mm-hmm.
give yourself what you need. So I will put a link to that in the chat. It's not something I made, but it's something that I absolutely love. And I think everybody should do it. It's a self-assessment tool. It just kind of lets you know where you are. And it gives you you're already burnt out, you're approaching burnout, you're not burnt out at all, you're at risk
Okay.
for burnout. And so it really kind of helps you to see where you're at so that you can kind of reframe your focus a little bit and go, okay, well, this really is a problem. And so in this area, there's some things that I need to do. So that's one of them. The other one is using a checklist that I have. So I have a checklist that is available on my website, and it is a resilience beats burnout checklist. And it really kind of goes through things that you need to absolutely let go of, and then things that you need to continue to do for yourself. And it really digs into some of the things that we have a hard time with, things like perfection and trying to do it all ourselves and not delegating to teams and things like that. So it really kind of gives you an idea of, these are some things that I can really just let go of right now. They are not serving me.
Mm-hmm.
I can let them go. And then these are some things that I want to continue to do or start doing if I'm not doing them. So those are things that they're really helpful. And always affirmations. Affirmations are hard to give people because they
Yes.
need to be a direct reflection of the negative self-talk that you struggle with. You
Mm-hmm.
need to come with something positive that counters that negative. So they're not things you could just give somebody affirmations, be like, here, these are yours. Because if they don't affirm something that they're struggling with, they're not helpful. You're just saying positive words, but they're not really dismantling that negative self-talk that you've got. So
Yes.
each of us knows what our negative self-talk is. We all know it. It's not a secret to us. Now, we might not be telling other people, but it's not a secret to us. So if you know these are the things I struggle with, go online, put in affirmations that counteract that thing. And they're everywhere. There's
Mm-hmm.
affirmations for literally everything.
Everything.
So
Yeah.
put them in and then write down 10 of them. 10 of them. Write down 10 of them. And every time you start to have that negative image of yourself, that negative self
Mm-hmm.
talk, that thing creeps in, you pick one of them and that's what you say. So you'll take them, put them up on your mirror, put them up in your
Yes.
bathroom, anywhere where you're going to
Yes.
see them. Put them on your phone, anywhere where you're going to see them. And then you pick one of them to say to yourself every time that negativity creeps in.
Mhm.
You're going to counter it with positive. And soon that negativity is going to stop creeping in because it gets no response. So it won't come.
That's right.
It'll just leave. And then you'll have something else. There's always a, top 3, 4, 5 things that you have that you're struggling with. And so then you just go to the next one. You start with the one that is the most painful for you, the thing that you
Right.
really struggle with the most when you tell yourself these negative things, the thing that keeps you stuck the most. Start with that one. And then you just go through. And as that no longer becomes an issue, you go to the next one and the next one and the next one. And then you keep saying them. So you can't like let your foot off the gas and be like, oh, okay, now I'm feeling good now. I've done this, right? You have to keep saying them because they'll come back after a while, or you'll get new ones.
Mhm.
You'll get new things that you tell yourself. So as you grow and as you evolve as a person, you get new problems, right? We all know that. Like the
Right.
problems I had 10 years ago are not the same ones I have now.
Right.
So as you get new problems and you get new things that come and you get that negative self-talk that comes from those, as a direct result to stop you from doing where you're at now, you want to make sure that you get some new affirmations and you just keep them and roll them through.
Mhm.
So those are my top three things.
Awesome. 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 I love it. I love it. I love the part about the sticky notes because I use that. I teach that. Some of our things are quite similar and we didn't compare notes. So I love it. I love it. I love it. That means that the synergy is there. I love it.
Yeah.
So I love the part about those sticky notes. I say put something in every single room that you know you're going to be in your home that day. So no
Mhm.
matter where you are, there's something positive wherever you are.
Yes.
So you can't
Yes.
avoid it. Because
Nope.
there's a saying, out of sight, out of mind. So if that
Mhm.
positivity is out of sight, it's not going to be in your mind. But if everywhere you go and you're looking, there's nothing but positivity around you, you can't help but to vibrate to that. I
Absolutely.
love a book called Let Go of the Small Stuff. And then it
Mm.
quotes, it says, and it's all small stuff. So sometimes we make things bigger than they really have to be in life. And so if we think of everything as some small stuff, I mean, there's some weighty things in life, of course, but
Yeah.
our reaction, our response is what shapes how much it affects our lives. So I love
Absolutely.
that book, Let Go of the Small Stuff, and it's all small stuff. I can't remember who wrote it to save my life. And then there's an old book called What's Really Holding You Back. Sometimes we
Mm.
get stuck because of our own selves. We're holding ourselves back. So I love that book, and it really, really makes you think about what is your mindset? What are your actions saying about where you're saying you really want to be? So I
Yeah.
love that book. That's by Valerie Burton. I do know that. So what's really holding you back? As far as some resources, as far as helping people to recharge and relax and just perform some self-care, I love the Calm app.
Mm.
I love sound bowl therapy. Sound bowl therapy. Anyone who doesn't know about that, I recently got certified in that because I was so intrigued by how well it changed the frequency of your brain. So when you're anxious and you're feeling depressed, you can pull it up on YouTube. I
Okay.
actually have to get my bowl. I haven't gotten my bowl yet. They're pretty expensive. But sound bowl therapy, just by a couple seconds, it changes the frequency of your brain. It helps to just de-escalate you. It helps you feel it go through your whole body. So it's like vibration and sounds at the same time that actually helps to calm you down and just help you just to have less stress. And then
Good. Yeah.
megahertz music on YouTube, I'll play that. And that too is another form of music that helps to change the frequency of your brain to take you out of that stressful, anxious state and just bring you to just a calm, relaxing, recharged state where you feel like, oh, okay, it's not that bad. It's better now. So that's
Yeah.
what we have to do. We have to de-escalate ourselves, know what works for you. And those were just a couple things. So I'm excited. This was a really, really good conversation. An hour
It
went by
was.
super fast, but I don't want to leave without you letting everybody know again who you are, where they can reach you, and if you have any offer or anything like that you'd like to offer to anyone.
Absolutely. So I am Rasheda Hatchett. For those of you guys who didn't catch my name at the beginning, I am a resilience coach and strategist. I work with leaders who are really looking to build their own resilience and then to build resilient teams and organizations as well. So I am super excited about that work. It is so much fun to help people just kind of dig into how do we bounce back together, and how do I bounce back as a leader, because there's so much that's happening for us right now.
Yes, yes.
And our leaders are charged with, being at the helm of that when they have never been through something like what we're dealing with right now, on either side. So we talked a little bit earlier about COVID, and then there are the protests that are happening because of George Floyd's murder. And so these are things that employers are just not dealing with they haven't had it. They've not seen it this way. And so because of that, they really are having to do so much more. So I want to make sure that folks who want to reach out, they need that kind of education. They want someone to come in to their organization to provide that. You can reach me at RashedaHatchettMedia.com. I am there. That's my website. You can go on and book on my calendar, and you can reach me there. I also have my free resilience checklist that is there on my website that you can subscribe and get that for free. It is a wonderful
Yeah.
checklist. It's going to give you some great ideas on what you do and how you do it, so that you can bounce forward and you can thrive. And that's the big piece of resilience. Is the other side of resilience is thriving, right? Doing well in this new environment that you're going to be in. And with COVID and the struggles that we're having with race in our country, we really want to make sure that on the other side of bouncing back, we're thriving, we're doing well. And
Absolutely.
that's the other piece of that. So you can reach me there. I'm also on LinkedIn as at Rasheda Hatchett Media. You can find me on IG in the same place at Rasheda Hatchett Media.
Awesome. Thank you so much for your time this evening. It was a really, really good conversation. For those who have missed it, please make sure you watch the replay. This will also
Yeah.
be on my YouTube channel at Chere M, Goode, the Recharge Strategist. For anyone who doesn't know me, I'm Chere M, Goode, the owner, founder, CEO of Total Harmony Enterprises, Make Me Over Wellness, and Exceptional Wellness Candle Company. So please look me up on the web. TotalHarmonyEnterprises.com is the umbrella for all of my businesses, so you can find a way to reach all of those businesses through that website. Don't forget to recharge your batteries, even if you just take a mere 5 to 10 minutes every single day just to love on you. You are resilient. You are wonderfully made. You are enough just as you are. Don't let the current world events tear you down. Every day, do something to build yourself back up. Thank you
Yes.
so much for your attention this evening. Thank you for everyone that's on Facebook Live, everyone that's on the live feed. We truly appreciate you. Everyone have a good night, and don't forget
Good
to
night.
recharge.
Good night. Thank you guys. Thank you for having me. I so appreciate it. We had such a good talk. Thank you.
Absolutely. We'll do it again real soon.
Yes.
Good night.
Good night.